Hey, you had surgery, you did PT, you followed all the pain management doctor's recommendations, and here you are, still in pain every day. Do you ever think that maybe they were looking for where the pain was coming from in all the wrong places? On this episode, if you're in chronic low back pain from surgery, you don't want to miss this. I'm going to tell you how I would look for where the pain is. And I got to tell you, it's not anywhere near they've been looking.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
All right, so let's talk about the patient who's been through back surgery. They've been to chiropractic, maybe. They've been to physical therapy, maybe multiple rounds. They've been to pain management and have had epidural steroid injections, and they're still in pain. Every day they wake up, or maybe you are waking up and you're in pain and you're wondering, do I have to live like this for the rest of my life? And you're not getting answers. You go back to your surgeon, and they're nice people. They did the best they can, but they look at you and they maybe have taken more x-rays, maybe sent you for another MRI, and they go, I just don't understand why you're still in pain. The surgery was a success. We got all the bad anatomy out of there. I just don't understand. The physical therapist is telling you the same thing. We've done everything we can. You've had multiple rounds. We don't understand why you're still in pain. Pain management doctors, once again, I don't understand. The epidural should have worked. The medication should have worked. We don't understand why you're still in pain. Here's why they don't understand. When you initially hurt yourself, you had an orthopedic problem. They took care of it from an orthopedic perspective. They've tried to rehabilitate you from an orthopedic perspective. That's why it's failed. We've got to look at this through the lens of your nervous system. See, it's really pretty simple. Our body is made up of receptors. You have receptors in your skin, in your muscles, in your joint, in your ligaments, in your tendons. And when those receptors are not working, when they're not moving, they're not firing. And so the brain can't get the information up to where it needs to get it so that it will raise the threshold for pain. Right now, it's lowered. Any little thing that you do is going to cause you to have pain. Even thinking about going to the mailbox is going to cause you pain. And then the emotional aspect in the brain, where all this information has got to go, well, in the anatomical neighborhood is the emotional part. You've got to admit, chronic pain is emotional. You're frustrated, you're anxious, you may even become depressed. You may not be sleeping well. So we look at it through the whole lens of the patient. So what are we going to do? The first thing is a really good evaluation on you. I'm going to do a neurological evaluation, probably different than ever been done. And then we're going to recommend these things. Very simple things like stretch the muscles, get the joints moving, decrease the pressure on the facet joints and on the disc. Highly effective. But then what we're going to do is we're going to put BioWave on you. And BioWave is going to go block the pain right at the source. It's going to create a force field. And you know what? We're going to put the BioWave on you while you're on the Cox flexion distraction table. And so you're getting this real easy adjustment, and that blocking the pain from BioWave is going to be blocking your pain so that we can get movement. We can stretch those muscles. We can get the joints moving. We can get that space in between the discs to increase. And then after that, after we get you, that's the first phase. We get you out of pain. Then we're going to take and introduce our neurological therapy. This is our rehabilitation. And we're going to input at 500 pulses per second. We're going to reawaken those muscles, those deep muscles, the multifidus muscles that are just weak and they can't stabilize your spine. We're going to bring those back online, and you're going to start being able to stand up straighter. You're going to be able to move better. You're going to have better coordinated movements. Your balance is going to be better, and you're going to start doing things you want to do. We're going to get you out of that abnormal movement pattern because you're moving away from pain, and we're going to get you moving the way you should. And then we're going to put you into our brain tap entrainment therapy because we've got to get you out of that fight or flight. We have to address the emotional aspect, how much it's taking the effect on you and probably your family. I want you to sleep better. And so we put in the brain tap and Normatec compression therapy on those legs. It's going to increase the circulation. It's going to give you a sense of total relaxation so you sleep better. See, what's happened to you? It's not an orthopedic problem anymore. It's a neurological problem. You are neurologically starved because those receptors aren't firing like they should. And your brain is forced to centralize the pain. It's actually called centralization. So the injury, the surgery, everything's been healed up, but you got the bad message coming through in the neurological circuit. And it just keeps saying pain. We got to break that up and we got to get you going to move. And we can do that. You know what's really cool about all this? You can do it at home, outside the coxflexion distraction. All the therapies that I've just talked about, you can do in the comfort of your own home. Now, what I would recommend if you are in chronic pain to take it in steps. And the first step would be get yourself BioWave Go. If you get a BioWave Go, then we can take and get that on you and get your pain levels down. And you can actually start doing movement exercises with BioWave Go. Then when you're ready, you can go into our neurological therapy and then you can get into brain tap. I would actually recommend if you can do it, do BioWave Go and brain tap at the same time, purchase both at the same time, and you'll be able to get to sleep. We got to get you sleeping better. Here's the great thing about brain tap. You can do a 15-day free trial, use any headset that you have at home, and then you have the BioWave Go, and you really jumpstart your journey into getting out of the chronic pain. So yes, we do things differently. I want you out of pain, but I want you doing things at home. So there are plenty of home therapies for you to do. What are the results? We're going to decrease your pain. We're going to get you moving, and we're going to get you back doing the things that you love to do. But more importantly, we're going to restore hope because that's what this is all about. It's about defeating pain. And really, with BioWave Go, 30-day money-back guarantee, brain tap, 15 days free. We'll talk more about the ARP neural therapy later on. And all you have to do is lose the pain. So if you like this, and then the other thing, subscribe. But here's what I want you to do more than anything else. I need you to tell others. We know people are out there suffering, and there is help, and there is hope. I'll see you in the next episode.